Okay, so first I check my medical order, see that they've got an NG tube scheduled. I'm knocking the door, knock, knock. Hello, Mr. Smith, my name is Garrett. I'm going to be your nurse today, and we're just going to get an NG tube inserted. And the NG tube helps remove any stomach waste. It's not meant to feed you. We'll put IV, and that will feed you through the IV, so you won't be able to take anything by mouth while this is in. I'm going to close the doors, curtains, protect the patient's privacy. Got the hand hygiene going. I'm going to answer any questions they might have about the NG tube. I do my patient identifiers. I'd ask for name and date of birth. And I check their wrist and confirm that, and it's good. I would come over here and I'd gather my equipment. Bring it over here. I'd raise the bed to a comfortable working height and have it in Fowler's position at about 30 to 45 degrees, just to help it go into the nose easier. I would get my lubricant. And lubricate 2 to 4 inches. I would tilt their head back, or I would check to see what nose is optimal first. I'd have them plug one nose and like see what one feels better, and we're gonna go with this nose. And tell them to breathe in. Oh, before I do this, I would mark it to see. I would like test to see how deep it needs to go. So I'd go from nose to ear to end of the xiphoid process. Right there. And hit it with my marker. There we go. Guess we're gonna do it again. About 45 there. Get that marked just so we know how deep we need to go. Silly of me to forget that. Okay, and then after that, then we would go ahead with the insertion. Breathe in and have the head tilted back until they are like gagging, or I can tell that's reached the pharynx. I would then grab the water and have them sip on it, and as I sip, I would continue to get this down. I'd stop if there was any cyanosis, if they can't breathe, stuff like that. I'd pull it out immediately. I'd go until we're 45, we're at our little mark, and then I would loosely secure it. Hopefully that stays. I would grab a sample of this. Put it in there. I check its color, make sure it's not chunky. It just looks normal. Grab my little testing strip, dip it in, wait about 30 seconds, and make sure it's under 5.5, which it is. And so we know that we're in the right spot, but well, we know that's the initial test. The confirmation test is an X-ray to confirm it for sure. Now that we know that we're in the right spot, we'll go ahead and secure it all the way. Move its little legs. And go ahead and wrap each one around the tube just to hold it in place. I'd offer any like skin protectant and skin barrier just because this can cause some discomfort on the nose. Okay, that's secured. We can tighten it a little bit, and I'd check to make sure that it still hasn't moved at all. I would grab this and the connector to connect it to the suction part. It's got the adapter in it already. Make sure it's a little bit elevated. We had about on low intermittent. Make sure it's staying in that green area right there. I would then grab my paper clip. This is not a paper clip. This is a clothespin. Or I'd tilt their head away from this as I do this. Secure that down. You can look back now. I would then offer oral hygiene, any sprays or anything like that to help alleviate the throat. And then I would offer this every 2 to 4 hours as well. And then I take off my gloves. As I'm inserting the tube, I would obviously put this on them. I don't know what I'm thinking. I put this on them, offer them tissues and a basin just in case they throw up. That's as I'm inserting the tube. But I did not this time. Accident. For hand hygiene, I already said that. And then I'd document and just check them every 2 to 4 hours and offer oral hygiene